now I'm going to talk a little more about the reproduction number, provide the historical time series of our estimated reproduction number. So for those of you who aren't familiar, the reproduction number tells us something about how fast the virus is spreading. A value of 1 means that it's basically flatlining. And one way to think about it is like every person who gets infected on average is infecting one other person. And so every infection sort of replaces itself. Values above 1 indicate that the epidemic is going to be spreading exponentially. And values below 1 indicate that the epidemic should be dying out. And so what we see in Austin, so this is Austin going back to early March. In Austin, prior to closing schools and enacting our stay-home order, before we started mitigating this threat, it probably had a reproduction number somewhere between 2 and 4. So the average number of secondary infections was quite a few. We enacted these orders. They had the desired effect. The reproduction number came down somewhere close to 1, possibly a little bit below. And then we started reopening, and Texas was one of the first to enthusiastically embrace the Reopening of America plan, early May, mid-May, and we saw the consequences of that by June in many cities across Texas, including Austin. And we saw our hospitalizations, our ICUs going up at an alarming pace. That led the governor to allow local authorities to impose some restrictions, including some face masking, but not comprehensive face masking. We took advantage of that as soon as we could. Then the governor closed the bars. Then there were statewide face mask mandates, and you can see those had the desired effects as well. And now fast forwarding, UT opened somewhere before the beginning of September. Students came back to Austin around August 18th. We've kind of been holding our breath to see what's going to happen. There were some clusters of cases, and UT is, usually 50,000 students. We probably have at least 30,000 back in town, hanging out at frats, et cetera. There's certainly been clusters of cases at UT. And I think just now we're beginning to see the effects of slow but certain spillover from that and other activities around the city. And we're seeing our hospitalizations start to creep up again in an alarming way. We're also we also have a dashboard showing these kinds of projections for all of Texas. And this is just looking at all, I think, 21, 22 regions of Texas, specifically ICU. And you can see what you're hearing in the news. If you look for El Paso, it's the horizontal dashed lines are ICU capacities. El Paso doesn't have enough, can't take care of their patients. They're coming to Austin and they're taking our healthcare workers. Abilene, Amarillo, you can see that much of Texas, though not all of Texas, is either past the brink or already on the brink of really catastrophic situation in terms of the integrity of the healthcare system and consequent loss of life. Okay, finally, on topic 3, modeling to really support decision-making, modeling to really think about, given all this uncertainty, what kind of decisions can we still make that make sense, that are robust? And this is a screenshot from one of Austin's 2 dashboards. They call this the key indicators for staging dashboard. The different colors correspond to different levels of restrictions, where red is stay at home, orange is like mostly closed restaurants, no bars, I don't know what we're gonna do about schools, et cetera, yellow and so forth. Probably have one of these in your own city. And so what you see here is the city tracking the 7-day rolling average of COVID-19 hospital admissions, and with a clear indication to the public that when we cross these certain thresholds, we're going to change our policies. We worked very closely with the city to not only kind of formulate this approach, but to actually derive the values that separate red from orange, from yellow from blue, et cetera. Okay, so how did we come around to this? Well, first, way back when we were thinking about this policy in April, the question was, okay, what happens if we open up America on May 1st? We tell people to be careful. They're a little bit careful, but they're not very careful, and we just see what happens. Then we projected we'd have something catastrophic in Austin. We would probably have surges that overwhelmed our hospital capacity. By the end of the summer, lots of people would die. Nobody wanted that. So the question was, what should we do? Given that, we want to avoid loss of life, we want to avoid loss of livelihood, we have to obey the laws of Texas, which are pretty strict. We're strictly strict on the side of not allowing local authorities to close things down. So what kind of policy could we put in place that is sort of allowable and aligned with what we hope to do? So the first step, and arguably one of the most important steps in building a policy, is to figure out, to explicitly state what your goals are. And what we arrived at that kind of satisfied those needs was that we want a policy that will ensure that we keep hospitalizations and ICUs under our local capacity. And if at all possible, let's avoid stay home orders. Let's spend as much of our time open as we possibly can. What kind of policy options do we have to achieve those goals? Well, it's basically all the different rules under the different colors, different combinations of face masks, social distancing, gathering, restaurants, bars, et cetera. So those are kind of the levers we have to achieve those goals. And I'm not going to go into the details, but happy to talk about it more if you'd like to. But I'll just say that the solutions we came up with very briefly by building a detailed compartmental model of COVID transmission that was fit to data from Austin, and then implementing different kinds of thresholds for those different levels and using numerical stochastic optimization to figure out which thresholds were going to allow us to best achieve those goals. Ensure that we keep those hospitalizations under capacity while absolutely minimizing the time we have to be under red and orange.